Okay, YouTubers, this is the Angry Prepper. So today's episode, we're going to talk about the healthcare worker crisis or apocalypse, however you want to look at it. I know apocalypse sounds a little more dangerous, but it's a healthcare worker crisis here in New York State, that is. So I know a couple other states are following soon with the same vaccine mandate. So as of today, the 27th, they are now dropping the hammer on all healthcare workers and all healthcare workers that work for government-run hospitals, whether that's state or federal. They need to be vaccinated. Now, private hospitals are doing the same thing here in New York State. They're sort of following suit. So today is the day that the hammer is dropped, and we are going to see the outcome of this hammer being dropped here in New York State. Now, the nurses and healthcare workers in New York State have to be vaccinated as of today. If they are not vaccinated, they are getting fired. So this crisis is interesting nonetheless, because it's going to affect patient care as well, obviously, right? If you don't have enough healthcare workers to provide service to your patients, the patients are going to feel this on the back end, which, listen, you know where I stand with this whole mandate bullshit. So I am actually applauding this. I'm actually standing behind this 100%, that these healthcare workers don't take the shot. So I'm behind it 100%. And if that means the sacrifice of some, so the fuck be it. But the fact that they are automatically looking to fire people right out of the gates, and I mean, yeah, they had time to either pick and choose whether they wanted to get the shot or leave. Now, I think that a lot of people should have left. I think a lot of people were waiting to see what the state does or is going to do. And what they're going to do today, I'm pretty sure on some level it's illegal, but nonetheless, politicians do what they want to do, and they change the game how they change the game. And one of the things they're doing is Governor Hochul, I think that's her name, that's the asshole that took place of Governor Cuomo. She is looking to rewrite laws to allow people from out of state to work here without a license, and allow people from overseas to work here without a license, right? So you have to have a medical license or a nurse's certificate to work here in New York State, or in the United States for that matter, but nonetheless New York State. So she's allowing to change laws to let people from other countries work here, and even people out of med school to jump in it right away. There's a bunch of problems with that. One of the problems is you're gonna have med students come right out of medical school and jump right into the fucking deep end. They're undoubtedly going to kill people because they don't have the experience. You're going to have nurses that do the same thing. Out of nursing school, into a hospital, you're going to be the head nurse today. Meanwhile, you only been fucking nursing school for whatever, how many years you're in. These nurses are going to make a mistake and kill people. So a lot of people are going to wind up dying behind this. That's the long short of it. Now, this is not she's not changing laws, she's making a declaration. Mandates and declaration, guys, this is what politicians do to fit their narrative, to change their storyline. However they want to make it work for them, they will, by doing declarations and mandates. And the declaration, not a law, is to let people from, again, other countries, other states, right out of med school, right out of nursing school, work in a hospital at full capacity, right? So I guess, you know, you have to work as a nurse and a doctor some years to get that experience. I mean, listen, you're rushing these people in, you're putting them on the spot. That's going to cause a lot of problems, because these people don't know what they're doing, they don't have the experience, and now you're just shoving them in there and going, yo, get to work, and Godspeed. And then you're pretty much telling the patient Godspeed, because you're assigning patients inexperienced kids, pretty much. So data shows, and I hate the fact that I'm even repeating this, but data shows that 84% of the hospital workers in New York State are vaccinated. So that's about 450,000 employees or healthcare workers that are vaccinated. 83% of workers or healthcare workers in nursing homes are vaccinated as well. That's leaving 93,000 people who are unvaccinated or don't want to get vaccinated. And that is where the problem lies, because now you're going to have 93,000 people not at work, possibly getting fired. Now, do I think 93,000 people are going to hang tough, hang in there, and not get the shot? Absolutely not. A lot of these people are probably running to a vaccination site today to be vaccinated. But for those who stand their ground, I applaud you. But for those of you that don't, well, You tried. You gave it a good 1-2, the old hee-ho, and see where they went, and they called your bluff. Because the problem, the big problem is, guys, these government agencies don't give a fuck. They don't care. They are not bluffing. They are doing exactly what they say they're going to do. If you're going to get fired, you're getting fired. They don't care. They'd rather fire 93,000 people and short staff medical agencies or medical fields, doctors' offices and hospitals. They'd rather short staff them than fucking and have them delay care to patients than actually back down on something that doesn't need to be. So the short staff or the shortfall of employees will happen tomorrow, right? So again, I'm pretty sure that a lot of people are going to get vaccinated, but I don't think everyone is. Now, there's a hospital or a medical center, upstate New York, that right now they're looking to fire 400 people over not getting vaccinated. I think these 400 people are steadfast. They're holding their ground. This hospital now has to lay inpatient surgeries and transfer ICU patients to other hospitals because they're going to be missing out on 400 employees or healthcare workers. Again, guys, this problem hopefully gets bigger than it is now, because I know some of you are like, but my mother is in a hospital and she needs her elective surgery. This is called dropping the hammer from the people. We stand strong, we fucking stay firm. They're going to eventually crack, but we have to hang in tougher than they are. Because keep in mind, guys, they have the resources and they have different backup plans. Believe it or not, the New York State medical field, they have backup plans. So they saw this coming and they're like, well, we're gonna have backup plan A, B, C. They probably got a backup plan all the way to fucking like F. We need to have a backup plan all the way from A to Z. And that's how we win the fight. We win the fight by waiting them out longer. So the hospital or the medical center is Erie County Hospital, right? They're looking to let go 400 people. And I'm pretty sure out of that 400, some of them are sneaking off to get the vaccine and some of them are standing their ground. So we shall see today what happens, or rather later today what happens. There's another thing that is very, very important, and people need to listen to this part. If you get fired from whatever medical center you work for, whatever hospital you work for, you will not be eligible for unemployment. Let me repeat that. If you get fired, you will not be eligible for unemployment. This is why I think this is going to be a very, very interesting event, because a lot of these people know this and they're still hanging tough. They're still not doing what is supposed to be done according to the hospitals or the federal government, So the fact that they're willing to even go broke tells you a lot about the people who don't want the shot. People like myself know we don't need it. I don't need it. I don't want it. But people who are facing getting fired, that tells you all you need to know about the conviction in this whole bullshit. Now, if they offer testing to the nurses and doctors, they would jump on board with that. But they're not even offering them that. So in New York City, we are starting the testing as of today. So my next set in, which I think is Wednesday night, I think I'm supposed to get tested at work. So I don't have to go to a facility. I get tested at work, and that's once a week. I think that's going to collapse because, fingers crossed, a lot of false positives pop up. Now, like I said before, this is going to be very interesting as to who sticks to their gun and who fucking just gives up, right? I mean, listen, guys, I get it. A lot of people are in a position where they can't lose their jobs. They can't afford to lose their jobs. They can't even afford to, go without a paycheck. Now, I know that 2 other states are following suit. California, which is also tomorrow, they're dropping a hammer on their healthcare workers tomorrow, and Maine is dropping a hammer on their healthcare workers at the end of October. So they have a lot more wiggle room for their healthcare workers. But guys, this is all about fear. And this is all about now that they couldn't scare a lot of us into taking the shot through the events that are happening, now they're starting to scare you with losing your jobs. The problem is, it's not a scare tactic. They're going to follow through. So again, a lot of you guys who stood up to this bullshit and have lost your jobs today. So guys, I applaud a lot of you guys for sticking to your guns. But you're going to have to come up with a backup plan. You need a backup plan. You're going to need to make money somehow, especially if you are ineligible for unemployment. And if you can't get unemployment, then you need to have income somewhere. Now, maybe some of you thought ahead of time and were putting money away because you saw this happening. Good for you. But for those of you that didn't, you need another plan. Because unfortunately, guys, the state is not going to give in. I don't think they are. Or they might give in if this gets a lot tougher as far as patient care goes and patient services go. If that gets tougher, they might crack. They might just open up testing. Or they might just say, fuck it, let the chips fall where they may. But that's in a pipe dream. Other than that, guys, this is the Angry Prepper. Thank you for watching. You can like and subscribe to this channel. You can also follow me on Angry Truth channel and the Angry Lensman channel. And other than that, guys, thank you for watching.